This is very, very good news for students who want to pursue MBBS and MD in the country. That's because a recent report on Career 360 by Musab Qazi talks of the number of seats that have been increased in the country over the last year, and that is 20,098. The details of the articles are down below. You can also look at that article to understand the details, right? 20,098 seats were increased in 25-26 alone, of which the PG admission, the seats have been increased by 8,416, which is 11.33% in one single year. And the MBBS seats were increased by 11,682. And this also is the highest ever that India has increased. And if you look at it, in all, the number of seats that we had was about 1.92 lakhs between PG and UG earlier. And that's increased by almost 10% in just 1 year flat. And this information was declared by or announced in the Rajya Sabha by a Minister of Health and Family Welfare, Ms. Anupriya Patel, to a query that was posed to them in Rajya Sabha. So it's actually official document where the minister is talking of the increase in seats that you have. Of course, this also led to a lot of massive delays in terms of counselling, because the counselling is going on while new approvals are coming in. A few were being rejected, and that creates its own problem in counselling. But the good news is that the student has more choices. Hopefully, these increases have been done in good medical colleges where students are wanting to be studying there. And hopefully, it's also happening in those colleges which are more affordable, because when you actually look at the fee that is being charged by some of the private universities, which is 1 crore, 2 crore, 3 crore and all, then obviously it is being increased only for those people who can afford to pay that kind of fees. Remember, despite all these things, some of the seats are always vacant in these medical colleges because it might be non-clinical or whatever, because even in 24-25 in MBBS, there were 380 seats that were left vacant, and in PG seats, there are 2,849 seats that were left vacant. But having said that, the student has more choice, and that is something that I would always welcome. The other thing that you must look at is who all have got this increase, and when you look at that data, you suddenly realize that in the PG seats, Karnataka benefited the most with about 1,326 seats, followed by Uttar Pradesh with 1,034 and Tamil Nadu with 905. So very clearly, these three states are getting a bulk of the seats that have been increased. And for the MBBS, there were 11,682 seats that were increased, and that takes the overall count of MBBS seats to about 1,30,000. It's 1,29,872. So 1,30,000 seats for UG is what you have. The government of India has already declared that they want to increase about 75,000 seats over the next 5 years, starting 24-25. So they're well on their path, because in the very first year, they could increase about 11,682 seats, and that's very, very good. We must also know that never has such a massive increase ever happened in this country. If you look at the past data also, in the year 22, the UG seats, MBBS seats increased by 8,790. In 23, it was 7,398. In 24, it was 9,652. In 24-25, it was 8,641. And this year, it's 11,682. And if you look at PG also, again, never has the increase crossed more than 5,000 seats ever. Right? In 22, it was 4,705. In 23, it was 2,874. In 24, it was 4,713. In 25, it was 4,186. And this year, it's 8,416. This also sinks in with the overall government plan of trying to create some kind of equity and parity in terms of the MBBS seats that we have and MD PG seats that we have. So that also the government of India is working on. So very, very clearly, there seems to be some kind of a plan in motion to increase the number of doctors that we have in the country, to increase the number of UG seats that we have in the country and the PG seats that we have in the country, and also possibly create competition where quality also takes a front foot, because obviously students has more choices, so they will actually go to a better college before they come to the bad colleges. While we are all talking about this, I wish the government can also work on the kind of fee that is being charged by these institutions, because if you actually increase the seats in those colleges which are more affordable and quality conscious, it benefits the students and benefits the nation also, because we do not want doctors who become doctors having spent 3-5 crore rupees, because if they were to spend so much money, trust me, they would not be doctors for the community or the society, but they'll be doctors for the rich and the elite, and that's not what we want. We want students with merit coming in and becoming doctors and becoming good doctors and working for the nation, and not doctors who spend their money and a lot of wealth of themselves to become doctors, and then at some point in time they want to extract whatever they invested in becoming a doctor to from the patients like ourselves, right? But having said this is very, very good news for the country that you have such a massive increase in the capacity. You suddenly have at this point in time about close to 2 lakh seats between PG and UG. You have about 1,30,000 seats just for UG, which was just about 5 years back about 75, 80, 90,000. So very, very good news for the students. You have more choices. I just wish that this increases more in places where it's more affordable. Thank you.